Good afternoon. The city was notified early today that a third resident, a woman in her 70s, passed away due to complication from COVID-19. On behalf of the city of Baltimore, we offer our heartfelt condolence to that family. This is a tragic reminder of the dangers associated with COVID-19, and it's why we all must take the social distancing order seriously. I'm sure everyone saw yesterday that the governor issued a stay-at-home order. All persons living in the state of Maryland are hereby ordered, effective as of 8 p.m. last night, to stay in their homes or places of residence. There are exceptions for non-essential residents to travel to and from the grocery store, doctor's office, and pharmacy. But we really need everyone to stay home, period. So I want to re-emphasize that. We really need everyone to stay home, period. Every time you leave your house, you put yourself and everyone in your household at risk. Not to mention all of the people you come in contact with once you leave your home. We need all residents to do their part and stay home if you do not need to go out for one of the essential reasons. The number of confirmed cases in the state and in the city increases daily. Everyone has been talking about flattening the curve. Well, Baltimore, this is our chance for Baltimore City to do its part. If we flatten the curve now, we can prevent our healthcare system from getting overwhelmed in a few weeks. I just can't stress this enough. This is our chance to save lives in our city if everyone do their part. Now I will turn it over to our Health Commissioner, Dr. Letitia Sarasa. Mic is down, please.
Thank you.
All right.
Good afternoon. Thank you, Mayor Young, for your leadership, and thank you to my colleagues and our partners for their continued support throughout this time. Currently, Baltimore City has 187 confirmed COVID-19 cases, which is an increase of about 146 over the last 7 days, and there is evidence of community transmission. The Health Department response to COVID-19 remains focused on community mitigation as well as preparation for potential hospital surge. Our focus on community mitigation, as Mayor Young mentioned, is in an effort to decrease the potential further spread of COVID-19 to residents throughout the community, with a particular focus on protecting those at highest risk for severe complications, including our adults over the age of 60, those with underlying health conditions such as heart disease, diabetes, and lung disease. And while our messaging has been focused on adults over the age of 60, it's important to remember that all residents of all ages are susceptible to COVID-19. Therefore, everyone, regardless of age, should be practicing the social distance measures that we have enacted, in alignment with the stay-at-home executive order issued yesterday, as well as continuing the personal protective behaviors that we have also talked about. As a reminder, that includes things like frequent hand washing with warm water and soap for at least 20 seconds, use of an alcohol-based hand sanitizer, avoiding touching your face, eyes, nose, and mouth, avoiding touching frequent touch points like the elevator knobs or door knobs, cleaning those same high touch point surfaces with CDC approved cleaners, washing your hands after being in public, and coughing or sneezing into a tissue. Social distancing is the most important step that everyone in our community can take right now to decrease the number of people who become ill. Social distancing is intended to slow down the outbreak of COVID-19 in order to reduce the chance of infection among our high-risk population and to reduce the burdens on our healthcare systems. If you must go out for an essential reason, stay at least 6 feet away from others. If you or someone you're standing next to can touch arms and touch one another, you are standing too close. Even if you are not currently showing any symptoms, it's possible that you may have contracted COVID-19 and you may accidentally spread the novel coronavirus to a loved one who is at high risk. Please use your best judgment and institute social distancing. Now more than ever, residents should be on the lookout for misinformation about coronavirus, especially online. Please only use trusted resources. Verify before you share a post online. The Baltimore City Health Department website, coronavirus.baltimorecity.gov, remains a resource for residents, employers, and clinicians alike, as does coronavirus.maryland.gov and cdc.gov. We all have a part to play in keeping our community safe. Please stay inside at home, and please practice social distancing for your health and the health of your neighbors and loved ones. Thank you, and I'll now turn it over to Chief Ford.
Thank you, Dr. Tarasi. Good afternoon, everyone. The Baltimore City Fire Department continues to take progressive steps in helping members and the community to remain safe. As we make our way through COVID-19, this includes continuously sending safety messages to members about wearing their full PPE when coming in contact with patients, cleaning and disinfecting apparatuses, encouraging members to remain home in self-isolation if they feel sick, and to continue practicing social distancing. To that end, last week the department released information that 2 members tested positive for COVID-19, which consequently resulted in a temporary suspension of services from one station. During the suspension, the station was thoroughly cleaned and disinfected in order for members to return. Emergency services continued nonetheless, and our members were able to provide treatment and care from other stations within the communities that that station was suspended from. Additionally, we made the decision to have nearly 20 recruits at the fire academy self-quarantine as a precaution because one of the recruits showed signs and symptoms. Again, we continue to be committed to serving the citizens of Baltimore as well as paying close attention to the safety of our members. At this time, I'd like to introduce Commissioner Harrison.
Thank you, Chief Ford. Good afternoon. The Baltimore Police Department continues to adjust and modify its public safety efforts in response to COVID-19 pandemic. We are working with our local and state partners to educate and encourage voluntary compliance to the governor's new stay-at-home order. And with that, we're also encouraging residents to stay indoors if you absolutely have to, unless you absolutely have to be outside. It is important for residents to understand the seriousness of this dangerous and deadly disease. Per the governor's order, failure to comply with this order to stay home could result in a $5,000 fine and up to 1 year in prison. Therefore, the police department is doing everything in our power to be proactive in enforcing this order. Last week, we deployed an audio message that our officers are playing to educate and to help disperse large groups. We're looking at different messaging and different techniques to reinforce the governor's order, and we're working towards a comprehensive approach to make sure that residents are educated on how we will enforce this order. We continue to encourage our officers and our residents to practice social distancing. And while this COVID-19 pandemic is a challenge to all law enforcement agencies facing this, we will continue to address issues of crime in our city. Just last night, our officers encountered a subject that was armed and actively engaged in a shooting. Our officers engaged, fired, and as a result, the person expired and is now dead because of that shooting. An armed suspect is actually dead now. So let me be clear. The Baltimore Police Department is continuing to enforce the laws in our city. We're leveraging different units within the department to add capacity and personnel. The aim is to increase visibility and the compliance with the governor's executive orders and recommendations from public health officials. We will continue to respond to calls from residents for enforcement of the governor's executive orders. And the Baltimore Police Department is committed to working around the clock to keep members of the public and our department informed of where the agency stands with the COVID-19 preparation. Thank you.
Thank you, Commissioner. The city's Emergency Operations Center, or the EOC, has been fully activated and operational for about 3 weeks now. And we will continue to remain fully activated and operational 24/7 for as long as it takes. All agencies are focused on the COVID-19 response. At the EOC, all city agencies and partners continue to operate, planning and coordinating with our communities, businesses, nonprofits, state, regional, and federal partners. Our team is working in the Emergency Operations Strategy Room, continually planning for days ahead, weeks ahead, and even months ahead. So the city remains ready and prepared. We are being proactive and thinking outside the box. We continue to manage the resources we have, as well as requesting additional resources from the state and federal government to ensure our first responders, medical teams, and frontline employees have the supplies needed to help those who need our help. I want to give a special thank you to everyone in Baltimore who's been offering up their supplies, their facilities, and themselves to help with this emergency. Baltimore is truly an amazing city. If you would like to donate, please call 311 or go to the city's 311 website, 311.baltimorecity.gov. If you would wish to volunteer the opportunities, please call 211. Thank you. Now, Mr. Mayor.
Okay. I want to first of all thank all of the agency heads for your continued hard work and dedication to the city and its residents. And I want to thank all of the workers who come to work every day, those who are not teleworking from home. I want to thank them for coming in because they know that we have a job to do and to keep the city government moving. Now we'll take a few questions.
Mr. Mayor, the gentlemen, the people that work at the Capstone Waste Management Plant said they don't have enough gloves and masks to do their jobs. Any comment on that?
Well, I'm not aware of that. Matt?
We are getting all of the critical waste and water treatment personnel, all of the gloves and personal protective equipment we can. My understanding is that we do have plenty of that equipment. There was also, it was a dispute this morning. It is being handled currently by the Labor Commissioner's office.
Mayor, as a whole, do you feel the city is prepared to enforce the stay-at-home order?
I can't hear you.
As a whole, do you feel the city is able to enforce the stay-at-home order?
I think the city is able to enforce that. Most of the residents have taken it very seriously, and we haven't seen large crowds gathering on the corners. At least I haven't seen them. Mr. Commissioner, do you want to speak any further to that?
Yes, the city is prepared and is able to handle the stay-at-home order. As the mayor has traveled, I have traveled around the city. We are even receiving a few calls, but not many, about large gatherings, and we're able to disperse that. And when we do, people are complying with it. And so we are, by and large, seeing voluntary compliance.
Are officers instructed to, for example, check people on the street who are on the street as to their purpose for being out?
We have not given guidance to just arbitrarily make any stops, but rather when it comes to our attention or we inform or a complaint is filed, then we investigate that and then we can make that determination. But we are not just stopping to check just yet.
What is the policy concerning arrests?
Well, we want to encourage voluntary compliance. That's what we want to do. And when we find that people are not voluntarily complying, then the instructions will be to make a physical arrest. But we are working very hard in a proactive way to gain voluntary compliance.
Are any other officers self-quarantining after the officer tested positive last week?
Well, we've had a number of officers that are quarantined for a number of reasons. Not because that officer tested positive, because that officer was already self-quarantined for quite a while. But we've had some with international travel. We've had some that were made aware of exposure but not symptomatic and self-quarantine.
Do you have a number for how many?
As of this morning, I believe it was 39, but for different reasons, not because they were symptomatic or because they tested positive. We still only have that one person, to my knowledge, right now.
Before I go, tomorrow is April 1st. It's another April Fool joke, which means it is Census Day, and we need all residents of Baltimore City to be counted. So please fill out the census and tell your friends and family to do likewise. Again, thank you.